I hate to say this, but some healthcare providers are checking your blood pressure incorrectly. And even if they did, we know that being in the hospital alone can cause certain changes to your blood pressure, and the readings can be misleading. And this is why it's important that everyone knows how to check his or her blood pressure correctly at home. In this video, I'm going to highlight 8 common mistakes that usually happens in most of the healthcare settings, and I will tell you how much of an impact that can have on your blood pressure. But before we discuss the common mistakes, kindly like, share, and subscribe to this channel. Please hit the subscribe button. Let's grow this channel together. Please hit the subscribe button. Yes, hit the subscribe button before we continue. Now, I want you to pay attention closely to the next scene. Okay, a patient walks in, is about to get his blood pressure checked. But here's the catch. Everything that is being done is done wrongly. Okay, so I want you to spot what's wrong and the errors. Alright, so the first mistake happens just right off the bed. Okay, notice that the patient walks in and then we are about to check his blood pressure immediately. This is a very classic mistake. So you see, if you don't rest for at least 10 to 15 minutes in complete silence, then your body doesn't have the chance to be in a complete resting state or resting mode. And this alone can increase your systolic blood pressure, I mean the top value, by 10 millimeters of mercury, and that is very significant. Mistake number 2, you notice that patient started talking, immediately he sat down, and the healthcare provider was actually engaging him. So even before or during the BP check, both of them were talking. You see, even casual conversations can actually trigger muscle contractions and then activate your sympathetic nervous system. Now, what is sympathetic nervous system? You see that feeling that you feel when you see a tiger, or you see a dog, or you see a snake, you begin to sweat, your heart starts beating very fast. That's a sympathetic nervous system. Or a very beautiful lady you've been dreaming of, your crush, sends you a DM, says that can I have a dinner date with you? You see your heart starts beating very fast and you become dumbfounded. In other words, you'll be found to be dumb. That is sympathetic nervous system at work. So if you want to check your blood pressure, either at home or in the hospital, please make it a point to sit down quietly before we check your blood pressure for at least 10 to 15 minutes. No talking, no unnecessary movement. Mistake number 3. This is a little bit subtle, and the issue has to do with which arm should you place the cuff. Should you use your left arm or your right arm? Okay, now you must understand that there's a little bit of discrepancy with the arm, okay, as far as checking your BP is concerned. But what you need to do is that you need to use the arm with the higher reading, since that is more representative of your true blood pressure. So assuming you use your left arm, okay, your left arm, and then you get a BP of 140/90, and then you use your right arm and you get a BP of 110/70, please use the left arm, the higher reading, since that is more representative of your true blood pressure. Now let's look at mistake number 4, 5, 6. Okay, let's look at the positioning of the patient. The patient has no back support, the patient has no armrest, and the patient has even crossed his legs. Terrible. But of course, we actually planned this. Okay, not having a back support, armrest, crossing of your legs can elevate your blood pressure. In fact, even crossing your legs is even worse. It can elevate your blood pressure. So to have a very good reading, or a correct reading, or a true picture of your blood pressure, what you can do is that always make sure before you check your blood pressure, have a chair that has a back support, has an armrest. Please do not cross your leg. Make sure your feet is flat on the floor. And then also what you can do is that the arm that has the cuff, you can elevate it a little bit or prop it up a little bit so that it can be at the level of your heart. Mistake number 7. Let's just take a look at the BP cuff of our patient. It doesn't seem to be right. Okay, imagine checking the blood pressure for 2 people, Mr. B and The Rock. See, it will be wrong to use the same BP cuff for these 2 people, because obviously The Rock has a lot of body mass compared to Mr. B. So it won't be right to use a smaller cuff to check someone with a very large arm circumference and then use a larger cuff for someone with a very small arm circumference. If you do that, okay, if you use a very smaller arm cuff for someone with a very big arm circumference, then what will happen is that the BPs will be high. If you use a very large arm cuff for someone with a very small arm circumference, the BP will be low or not recordable. So to avoid having these false readings, what you can simply do is that you can just use a tape measure to check your arm circumference and then compare it to the size of the cuff. Yes, when you look at the cuff has sizes. I mean, it comes in ranges. So you can just look at the range, okay, and then just compare it to your arm circumference and then choose which one is appropriate for you. Take number 8. The type of device that is being used to check your blood pressure is very important. Some time ago we're using this old device, fake manometer, together with the stethoscope. Very good BP machine. Now with the advancement of technology, we are now using automated monitors. Okay, now you must understand that not all automated monitors are designed equally. Now I've noticed that quite a number of people are now using the wristwatch monitor. I mean, I get it. I get the point. I mean, it's very convenient, very easy to carry about. But my people, you must know that it is prone or subjected to a lot of errors. Even slight changes in your arm can alter your blood pressure. So I'm not going to recommend that for anyone. Now let's just imagine all the mistakes that we've discussed, we've highlighted, have been corrected. You must understand that there are some people whose very presence in the hospital can actually increase their blood pressure. Okay, what we call white coat hypertension. When you have a spike in your blood pressure in the hospital settings, maybe because they've seen a doctor in a white coat, or maybe they are seeing some needles, it can increase your blood pressure. So we call it white coat hypertension. This can falsely increase your blood pressure. And so what that means is that there are some people who are actually on medication who probably do not need it. Okay, they probably started the medication because of this white coat hypertension that they were having. But sometimes a false reassurance can even be worse than a false diagnosis, because there's another type of hypertension called masked hypertension, where patients' BPs are actually normal in the doctor's office but very high when they go home. So how often should you check your blood pressure? Now you must understand that your blood pressure actually fluctuates, okay, in response to your day-to-day activities. So it fluctuates to in response to stress, sleep, exercise. And so I advise you check your blood pressure twice in the morning when you wake up, and then twice in the evening when you're about to sleep. Okay, you can do that for about a week, and then what you do is that you check the average. Okay, you find the average of all the readings that you've recorded. Now if the reading is above 130/80, please, you need to see your doctor. I've actually done a video on how to reduce your blood pressure without medication, and I'll leave the link at the end of the channel. But of course, there are some people whose blood pressures are extremely high to the extent that they would need medication together with lifestyle modification and lifestyle changes. Please and please, let's take these things very serious, okay, because increased blood pressures over time can put you at risk of stroke, heart attack, and even kidney failure. Please like, share, and subscribe to this YouTube channel. I'll see you in the next video. Bye.